tagline for my company is humanizing AI for care. We've talked about how healthcare needs to be emotionally ready before it can be technologically ready. Help people feel safe, seen, and empowered as that change happens.
Latch on something which is already there and build on that.
And hundreds of thousands of dollars on the data that powers the technology.
The goal is to increase access to healthcare. In this instance, it's that sort of awareness, discernment, judgment, experience, right? As I always say, we have lived, AI has not. Human AI co-pilot sort of partnership. Right. And how do you engage in that partnership?
Today in the Signal Room, we're talking about what it really takes to scale care responsibly, not by replacing people, but by amplifying them. My guest today is Dr. Mark Gendreau. He has spent his career at the intersection where urgency meets innovation. He's an emergency medicine physician and a senior healthcare executive who's led teams through the most complex challenges in modern care delivery. As a physician leader, he's championed data-driven decision-making, operational readiness, and a culture of safety that keeps the human connection at the heart of every interaction. In this conversation, we'll explore how AI is beginning to collaborate with clinicians, where trust fits into that equation, and what it means to build systems to help people, not just process patients. Dr. Gendreau, you've spent your career on the front lines of emergency medicine and being a chief medical officer. When you hear the phrase scaling care with AI, what does that mean in a real hospital setting?
Yeah, what it means is that the goal is to increase access to healthcare. We are having greater needs in terms of the workforce in healthcare. We have aging physician workforce, nursing, and we're having less and less people entering into healthcare. So we need to, to me, as you said at the beginning, it's more of amplifying the workforce that we have so that we can reach more patients and improve the quality and safety of healthcare.
Yeah, there's a whole scarcity, I think, is the word I would use for a lot of clinical roles, and especially in the nursing area. I can see why it's such a focus that you have to try to use these tools to optimize the workflows so that people are freed up to do the things that they actually trained for, which is helping people. So I'm curious, because we've talked a little bit about this recently, but I really would love to hear and have you share with some of the listeners, where are you seeing some successes in how AI is being used collaboratively with clinicians, and what makes those specific examples successful in your
Yeah, so, three areas really immediately come to mind to me for in terms of, really amplifying clinicians and transforming their work-life balance as well. So digital radiology, we have AI tools that basically read images, for example, CAT scans. There's various modules that basically read the images almost instantaneously. They don't interpret, but what they do is they heads up the radiologist as to there's something that you should pay attention to on image 63. And some of these algorithms will actually give you a probability of, like, if you're doing a CAT scan of the chest, the probability that could be a pulmonary embolus. This is incredibly useful, if you're, particularly in the nighttime, or, there's less and less radiologists,
Right.
12 hours a day, they're looking at study after study. There's fatigue that builds in there. And with that fatigue can be diagnostic accuracy. So this really helps them really kind of focus, where they should be looking. It doesn't interpret, that's still in the hands of the human to basically discern and judge, what is going on and then do the interpretation. So I was at a conference in the spring, and there was a trauma surgeon in Nevada, and they were having issues with maintaining their trauma designation with the American College of Surgeons because they were they weren't meeting the guidelines for having a CAT scan of the head read by a radiologist so that they could quickly act upon. And they used this AI product so that it would alert the trauma surgeon that, there's an issue, take a look at, image, whatever, and it helped them decrease their time and get back to trauma designation. So very, very practical,
Right.
very useful, technology that is really assisting and amplifying the
Right.
the physician. Um, I would say the second is in documentation. And so we use ambient AI platforms
Yeah.
to assist physicians in documentation. This has been transformative to the primary care doctors, not only because it they that this it listens, and then when they're done, the note has been generated with about 97%
Mm.
accuracy as a draft, and this allows the physician to actually look at the patient and touch the patient and
Right.
spend more time with the patient rather than having their head buried in the computer, documenting everything that needs to be documented. And on the other side of this is we measure something called pajama time, which is we can see when physicians are in the EHR after hours.
Right.
And we see people who are still trying to catch up 10, 11 o'clock at night. And, this is not sustainable. So, that is a second example of the utility of it. We have an ED that is using an ambient system that also, when you're done with your note, it gives feedback to the clinician. You forgot to introduce yourself. The patient seemed to be a little bit tense when you were saying that, and your response, you could have approached it this way. So not only are you getting that documentation, the physician or the advanced practice provider is getting feedback to be a better clinician on a more human level. These technologies are really amplifying the human in healthcare and not automating them.
And that's fascinating. I actually was speaking with a company yesterday, scheduled for a half hour. I think I stole another half hour from them because I was excited having them walk me through what they were doing. But it was exactly what you're describing in terms of really undergirding and supporting the clinical interactions. So with every staff person that interacts with a patient, it's actually profiling the individuals that are interacting with the patient. It's profiling with the patient, and it's detecting, much like you said, detecting if there's tension or stress involved. Not only analyzing the words, but actually analyzing and detecting tone in the voice and the things that would indicate that there's stress are involved. Fascinating to me because I had not heard of anything that was geared towards wrapping around the encounter, regardless of who the individual was that was interacting with the patient. But they're having some really great success. It's actually being done by a physician who's come out of Stanford out in California. Definitely share some of that information with you, later today, just so you can take a look at what they're doing. It sounds like something that would be right up your alley as an advocate for helping to relieve the burden that we've continued to layer on to clinicians. You've touched on some great examples of where AI is being useful. Is there an example that stands out in your mind where there's a specific decision where AI added value or where it didn't? and what that taught you about boundaries between the human and the machine?
Yeah, I think, just to, like, where has AI sort of not been as stellar? We're essentially, 5 to 10 years into AI, right? And really into AI over the last, I would say, 3, 4 years.
Right.
And, we see improvement all the time. But take, for example, the digital radiology, where these AI algorithms will basically alert you to something. They still have issues with them. Like they will sometimes think something's going on, and it turns out that, when the radiologist looks at it, it's like, no, that's a benign calcification. That isn't anything that we need to worry about. And so there lies, as I say, the human brain, always keep the human in the loop
Right.
with this, right? Healthcare, and other industries where there's, high reliability, you have to have human in the loop every time. In this instance, it's that sort of awareness, discernment, judgment, experience,
Right.
right? As I always say, we have lived, AI has not. And it's those reps that, the clinician or the radiologist in this particular example, who's read thousands and thousands and thousands of images, that those reps, give that judgment and that insight that no, that's not anything that we need to be worried about.
Right.
That doesn't need to be reported, in that fashion. So that becomes very important.
Exactly. I was thinking about a simple example where, if you're my physician and I historically have a bit of high blood pressure, it's controlled with medication or whatever, but that any elevation detected by AI would be flagged. And so if no one knows that this is normal for me and it's I'm being treated, I mean, there can be decisions made that aren't necessary or alerting that could happen. Alert fatigue is something that I've heard quite a lot about over the years. Working in IT departments in particular, I've heard a lot of feedback that was not necessarily favorable about the alerts that we were triggering for, like, seems like everything under the sun. So I want to kind of dig into trust a little bit. I know we talk a lot about, do we trust AI? We've discussed this, and more recently, I've been hearing a lot more conversation about the trust in human relationships. With technology moving so fast, we know that trust still is built slowly and deliberately. What helps clinicians trust AI insights enough to act on them?
Great question. So, you think about what is trust, right? And Stephen Covey wrote a book on trust, actually, I believe 2 books on trust. And he defined trust is an equation that has credibility plus judgment plus safety. He called that intimacy, but he was meaning more like psychological safety,
Right.
and divided by self-orientation, or is what is this being used for? Is this being used for good, or is this being used for bad? So kind of the
Right.
ethics component
Yes.
of it. And so I think that, we can kind of, for AI, for because healthcare is, a field of a lot of relationships, of trust, of quality and safety. And so, it needs to have those kind of components of trust, of, the capabilities have to be good. The reliability of it needs to be solid. We're not going to trust something that, has a reliability, like, half the time there's issues with its output or what it's actually doing. And, it's got to contribute to safety. And so I think those are kind of, the components of trust in AI adoption. I think when those are met, clinicians feel more comfortable interacting with AI. And, we've seen this with our ambient hearing documentation platforms. Is initially the clinicians are a little bit reserved on this. Their trust is very guarded. But as they become more comfortable with that interaction, as AI starts learning about their preferences and what they like, what they don't like, and when they train it, saying, you said this, the patient actually said this, that's the interaction that you need. Then the trust comes and people are more word gets out and people, adopt it. We had a lot of laggers with with our ambient AI platform, and as soon as more and more of the early adopters, late adopters, uh, came aboard, we leveraged them to influence the laggers to come on board. And some of those laggers become the biggest sort of champions of the technology.
That's phenomenal. Yeah, I've often seen things kind of go sideways when these type of efforts are viewed as an IT project. We'll build, I don't mean this, that everyone does this, but I know historically there's been a lot of times where solutions were developed and just imposed. And, people that I've spoken to in your profession have looked at me and given me an eye roll. Like, you did it to me again. Why are you wasting my time? This does not solve a problem I actually have. But there are some you could solve if you'd like to listen. I love how you're approaching it. I'm sure that your colleagues are grateful that you're kind of on the tip of the spear in leading through this, because it is a bit of a frightening exercise when you've got all these things coming at you, this pressure to use it, and this explosive growth in volumes of data that you have to process quickly to diagnose something or to decide how to treat it. We've only been layering and layering constantly, whether it's for the purpose of improving quality. We add data elements that have to be captured, and then all of a sudden there's penalties being imposed based on an average rather than an individual, which I don't think is an interesting problem that we're going to have to solve for in regulatory areas. Because now, as you know, if you take the averages that we're measuring against, you're never going to find an individual anywhere on the planet that matches that profile. But yet we decide to penalize or incentivize based on that. The practice of medicine is an evolving science, of course. So I don't know how we are going to get there, but I think we really have to lean in on the regulatory side and make sure they understand the regulatory nature of things historically has not been based on reality. It's been based on a static snapshot in time, essentially, which is not going to work with AI. What you're doing in your building, I think, is it's really a culture that you're developing there. How should hospitals be thinking about creating that culture where the data and human judgment reinforce each other instead of competing? Because I know there's, in some cases, a tension between those things.
Yeah, I think that, it needs to come from leadership, right? Leadership plays a big role in this of showing people that, getting them involved in this, giving them agents, really allowing people to experiment with it and be creative with it. All that is part of change management.
So when you're working on these types of things, there's one thing when you're just trying to kick the tires and try to get people used to it, but at some point you got to start figuring out how do you scale it, and what are the indications that you're going to be looking at to determine when it's actually time to scale. So from an operations standpoint, what are some of the challenges to scaling these AI systems across the health system that you've encountered?
Would say the biggest obstacle is threefold. I think it's interoperability is probably the biggest one,
Right.
and then governance is the third, and then basically what's a good term for it? How your structure with respect to in terms of training the models, like a lot of health systems now are partnering with, one of the big AI, LLM, uh, you know, companies and using their model, parking it behind a firewall, and then training it with internal things, right?
Right.
So that the model starts to kind of get an understanding. It knows who we are, it knows what we do and things of that nature. We're actually being very busy in our health system with and making sure that it's ready for prime time for the masses in the health system.
Right.
And we've been busy with setting up governance. What do we push out? When do, to who and
Right.
how do we do it? And aspects of that. And then the interoperability is a big thing, right? Because it involves getting the right APIs, making sure that everything is talking to each other. Because if you don't do that, the data is just not useful to you. Those are, I think, the key components of scaling up AI health system. This was all pointed out, by the way, in 2022 when the National Academy of Medicine put out a document on artificial intelligence, with respect to healthcare.
Right.
That's a worthwhile read if you haven't read it.
And I appreciate that. There's this human factor that oftentimes just it doesn't get the time and attention that it needs. And one of the most important things that I've realized that I need to help messages start with listening and having conversations with someone like yourself. This is a really important thing if you're going to try to develop any kind of solution to make things better. You're talking about scaling. What are some of the signals that you're looking for to know when your organization's ready? This is not just a technical readiness, but there's the cultural aspect of it as well.
I would say um, when kind of like what I alluded to is that you've got leadership who's involved, right? Like the beauty of AI is that you don't need to be tech savvy. You need tech savvy people, but for the most part, I mean, I'm not tech, right? But that's the beauty of AI is that AI really doesn't that most people who do very well in AI seem to be not tech savvy, but
Right.
people who are creative, are good problem solvers, and then have those core elements of like human centric leadership that
Right.
they've got strong empathy, they're ethical, they're, trust is a building trust is a non-negotiable sort of thing with them.
Right.
And I think that, when you've got leadership who isn't trying to basically push it to IT to roll out, but it's the upper leadership who is basically, like we need to do this and here is the why and here is the how, then I think, that culture changes. More and more people start using AI, for like generative AI, and it just becomes a catalyst for readiness. And I
Right.
think that you know, there's multiple layers on how do you know when your organization is ready. I think it's not just one thing, it's multiple things.
Yeah, absolutely. It's a lot more complex than we would like it to be for sure. You touched on something else with there's this ethical considerations, and one of the things that's been challenging my thinking, and I'm not quite sure if this really requires guardrails. It may actually require some that we have to figure out. But how empathetic do we really want the technology to be? Because there's a risk now that people trust too quickly and too easily, and that's a concern. Where do you think some of these lines might be to make sure that we're keeping medicine focused on human beings and trusting human beings, and we're making sure that empathy doesn't get lost in our rush to get efficiencies?
Yeah, I mean, AI is great at a lot of different things, pattern recognition, I'm all for automating repetitive, things that are fairly routine in
Right.
terms of patient care. But I think that if you're doing something that requires emotional intelligence, something that is going to require emotional intelligence, relationship building, or shared decision, that ain't AI's territory. That's the human, right? And one of my favorite favorite quotes from Jeff Woods is, you are the leader and don't ever abdicate your leadership to AI. And so I would flip that to you are the human, never abdicate your role, your humanness to AI. I think that I was listening to a podcast recently, and they were discussing like how as we become more and more into AI and it becomes more agentic and things of that nature, we're going to have an AI. We're going to have two workforces. We're going to have an AI workforce. We're going to have a human workforce. The important thing that we have to do is that we need to make sure that we keep those kind of separate. Like we don't try to humanize the AI and start calling it names and everything because the technology is going to there's some technology out there that you can't tell the difference if you're speaking to a human or a robot.
Right.
Um, and um, and so we have to make sure that we don't get down that track too far because we giving away um, our human traits is just not going to be a good thing.
No, it's clearly a risk, and I think the dangers that are there because there's also this trust factor. We
Yeah.
can't be sure that we're going to get people to really follow the guidelines on what you should and shouldn't use these technologies for. Increasingly, people are connecting, listening to, being influenced by people who look, think, sound, and behave like they do, and they're not necessarily listening. Oftentimes, that can be a real miss if you're trying to run an organization as a CEO, and your people aren't trusting you that you're going to do things in a way that they don't have to be terrified of losing their jobs. That there's got to be an awareness that you've got to find ways to message so that you know that people are really understanding, and they can actually make the decisions to follow it. From a leadership standpoint, I think there's a really significant need to understand better uh, what the experiences are for clinicians. We haven't gotten too far into the burnout kind of conversation, but we know that there's a fair amount of that because you mentioned documentation being done up until 10, 11
Hmm.
o'clock at night. How should leaders be thinking about protecting their clinicians from things like the alert fatigue or over automating, but still we want to make sure that we're moving innovation forward?
Yeah, I mean, alert fatigue is big, particularly in the nursing side of things, right? Because they're up there on the floors continuously, and there's alarms going off everywhere. And I would say that uh, an alert needs to earn the right to interrupt a clinician, right?
Right.
I think is a good way to think about it moving forward. And so, and then another principle is if you're going to add something, you need to take something away, right? In terms
Right.
of, and so we have so many technology, we have so much technology with alarms and everything that one of the big things that we have become increasingly more concerned about is it almost becomes just background noise that the people don't even hear it.
Right.
And so that's why, it's on humans and leadership in healthcare to put together alert fatigue committees and actually review what sends alerts
Right.
and what's the value that it's providing and what's the impact that it's doing and you know if it's not adding value and it's having a negative impact, we need to basically change up that technology.
That fits the whole purpose of the podcast that I've created here. There's a ton of noise, and if everything is triggering an alert, there's really no point anymore because that's all you're going to do is respond to alerts, and then that's just not a productive way to use the technology. I think it's going to be a very interesting challenge because there just seems to be so many great ideas coming forward, and I'm sure that you're getting full inbox with your emails from people who have the best things in sliced bread, but it's only going to solve a fraction of a problem that you really want to solve, and that's just not sustainable. But there's so many of them coming at us all the time, but it's really hard to detect sometimes where's the one that's got some real value and can have some real impact.
There's a lot of noise out there,
There is.
and that signal to noise ratio, we got to somehow make that better.
So if we look forward 5 years from now, speaking of signals, what do you think will be the single most important one that you'll be watching that tells you that this AI and human collaboration are actually improving care?
I would say outcomes, that we're seeing better health outcomes. We're seeing, the health disparities, gaps, um, shrink or go away totally. And pajama time goes down to zero. I think those are the signals that would tell me that we've succeeded.
Well, you just used the term that I'm sure I'm not the only one that hasn't heard this, but please help me understand what the pajama time is really all about. That's probably doctor code, I imagine.
Yeah, that's so when a clinician is documenting, 10, 11, 12 o'clock at 12 o'clock in the morning, to catch up on documentation, that's what we call pajama time.
I might have to borrow that, but I'll give you credit. Dr. Gendreau, if folks are interested in reaching out to you to obviously to understand what it is that you're doing, that you're seeing bring successful adoption, how do they reach you?
They can best reach me on LinkedIn.
Fantastic. And for those that are listening, I'll make sure that you have all the information you need in the show notes to reach out to Dr. Gendreau. It's been a pleasure to have you on today. Fascinating conversation. I'm sure we'll be having more of them in the future, but thank you so much for taking the time. It means a great deal to me personally. So thank you for being here, Dr. Gendreau.
You bet, Chris. Thank you.
Well, that's going to do it for this episode of The Signal Room. If today's conversation sparked something in you, an idea, a challenge, or a question, don't keep it to yourself. Join the conversation on LinkedIn or visit us at signalroompodcast.com. We're here to amplify the signals that matter across leadership, ethics, and innovation in healthcare.